Tonight on KQED Newsroom, the opioid crisis, what Bay Area communities are doing to tackle an epidemic of drug dependency and overdoses. And as the U.S. pulls out of the Iran nuclear deal, we get a local expert's take on what this means for foreign relations. Plus, how 3 UC Berkeley students are using their tech expertise to help combat terrorism. Hello and welcome to KQED Newsroom. I'm Thuy Vu. We begin with the opioid crisis. This week, Marin County announced it will sue a dozen pharmaceutical companies for aggressively marketing highly addictive opioid medications. 30 counties across California are separately suing drug companies to recoup tax dollars they've spent responding to the crisis. Opioids include not only prescription painkillers, but also illegal drugs like heroin. While opioid prescription rates have declined, overdose deaths continue to rise nationally. In California, more than 2,000 people died from opioid overdoses in 2016, according to the state's Department of Public Health. And joining me now to discuss different strategies to tackle this crisis are Dr. Scott Steiger, an associate professor of medicine and psychiatry at UCSF, KQED health reporter Laura Klivans, and Marin County Counsel Brian Washington. Welcome to you all.
Thank you.
Thanks. Dr. Steiger, let's begin with some definitions. What types of drugs are categorized as opioids?
So opioids are divided into 2 main categories: opiates, which are derived from the poppy plant. So that includes things like morphine, codeine, heroin, and the more generic synthetic opioids like oxycodone, fentanyl, etc., hydromorphone. Those are in the broader category of opioid.
And so how do legal prescriptions then fuel this crisis? Don't people need the drugs to manage their pain?
So in the mid-90s, with the introduction of long-acting oxycodone, brand name OxyContin, the number of prescriptions for opioids for pain increased dramatically. And that continued until about 2012, at which point since then there's been a decrease in the number of prescriptions. The problem was that too many people had too many opioids, and too many brains being exposed to that addictive substance led to some problems, namely that people became addicted to those things and needed to make sure that they were able to obtain that opioid, that chemical. The problem is that if the doctor no longer prescribes it, or they no longer have access, or the doctor is not available to give the prescription, the person still is physically dependent upon the substance and needs to figure out a way to have that happen.
And that's what's led to the crisis we're seeing now nationally. And I know, Laura, you've been looking at this issue in the Bay Area. How big is the problem in the Bay Area and in California as a whole?
Well, as you mentioned, the number from 2016, it was over 2,000 deaths in California. But when you look at the country, our rates of opioid deaths, they are not high, not quite as high as the eastern states. But then you look at California as a state and you break it down by county. Our rates in the northern, more rural counties, they are in the same category as some places in West Virginia. So they're quite, it's quite bad. The San Francisco Bay Area is not that. In 2016, we had just under 100 deaths in San Francisco.
I know that Brian Washington in Marin County, you have now filed a suit against opioid manufacturers and distributors, accusing them essentially of falsely promoting the safety and efficacy of their painkillers. This comes after 30 California counties decided to join a similar but separate suit. What is your legal premise behind all this?
Thank you. The core legal premise is that the distributors and the manufacturers misled physicians and the public that prescribing opioids was safe for use for general chronic pain. They indicated that people only became addicted at about a rate of 1%. Turns out now current estimates are that addiction rate is about 50%.
So are you basically saying the companies knew about this, they saw the problem coming, and they chose not to do anything about it?
That's correct. They relied on false evidence in distributing and marketing these drugs widely.
And so there are many lawsuits on this now across the country, right, involving hundreds of cities and counties nationally. What is the scope of this? How large could it get? We saw, for example, in the 1990s, a lot of communities were engaged in litigation against tobacco companies. That resulted in the largest settlement ever of more than $200 billion. Could it reach that scale?
We hope so. We think that's a very good comparison, the tobacco litigation 20 years ago. We now have, I think, over 400 cities and counties and states involved in the litigation, and we think the public health problem is of the similar magnitude, and it deserves a similar solution.
And so, Laura, California is also taking legislative action on this. This week, the state assembly passed a bill that basically limits doctors in most cases from prescribing more than 5 days worth of opioids to minors. That bill now goes to the Senate. What's been the reaction on this from the California Medical Association and other doctors?
Well, the California Medical Association is opposed to it. And then doctors that I've spoken with, they feel, one of them mentioned he feels it's too little, too late.
But wait, let's backtrack. Why is the CMA opposed to it?
My understanding of why they would be opposed to it is because it is getting into the territory of legislating what a doctor is doing in their doctor's office. The doctors that I've spoken with, they feel in part that it's too little, too late. Regulation around prescription opioids, that is the first phase of the opioid epidemic. Then people have moved on to heroin and now fentanyl, and those are also deadly forms of opioids. So there's that view. And then also doctors who are prescribing opioids to kids, they have gotten a lot of this education at this point. And so they're doing it in really severe cases. So these might be kids who are in hospice or who experience an extreme amount of pain. So one doctor I spoke to said, listen, if you limit what we can give folks, it could have a really negative effect, similar to what Dr. Steiger was saying, where it might lead someone to go try to find their, they have a dependency, they need to go fulfill that elsewhere. And it might lead to that. And so he's saying, yes, let's get rid of prescribing in the way that we do, but it needs to happen slowly. It can't just be legislated out all of a sudden.
Dr. Steiger, do you agree that legislation is not an effective way to address this crisis?
Well, I think that it depends on the legislation. This particular piece, I don't treat kids, so I can't really speak with much authority about who needs pain relief through opioids or not in that particular clinical setting. But I can say that it has not yet proven to put a curb on the number of overdose deaths on a national scale or in California. And so it seems like maybe other ways of, other kinds of legislative interventions would be more important for curbing the tide of death.
And Brian Washington, I know that in Marin County, aside from the lawsuit, it's also been pretty active in stepping up and trying to find a community-based solution to this. Can you talk about that?
That's correct. I can talk a little bit about it. Our public health department is leading an innovative program called RX Safe Marin, working with physicians, working with the public, working with nonprofits to make sure we're really ratcheting down the level of opioid prescriptions, and that's been a very successful effort the last few years.
And this is it's pretty innovative. It's a whole collaboration between law enforcement groups, doctors, pharmacists, intervention specialists, right?
That's correct. I mean, it's a problem that spans many disciplines, and everyone's got to get involved in solving it, and that's what RX Safe Marin is all about.
And Laura, I know you've been also following up on treatment programs. So what types of treatments are available out there?
There are a variety of treatments available. The most common are methadone and buprenorphine. And methadone is something that has more regulation around it. So if someone is getting treated that way, they would go to a methadone clinic. And then buprenorphine is something that can be prescribed. So that could be more effective and more appropriate for people in, let's say, rural counties that cannot make it, can't take that bus ride that's an hour and a half to a methadone clinic that's hard to reach. And then another thing that I've been following is the efforts in San Francisco, which are really amazing, around harm reduction. And so this is something for folks who are not yet ready to maybe transition to treatment. But in San Francisco, these things mean you can go to a needle exchange and you can get clean needles, clean syringes. You can even get little strips that test a drug to see if it has fentanyl in it. And so someone will probably still do that drug, but maybe if they know there's fentanyl in it, they will use less of it. They will use it with people around. And another thing that we're doing in San Francisco and other places around the state is distributing Narcan, which is the opioid reversal drug. I went with one of these harm reduction individuals, and she trained bartenders and people who work in clubs. That is totally unique. So next to their first aid kit, they are going to have a little nasal spray injector of Narcan.
Interesting. So Dr. Steiger, with all these options out there, is there a particular treatment strategy that works the best in your experience?
Well, I'm biased because I work at a methadone clinic, so I think it's the gold standard. It's been around for over 50 years. We know it works. It is incredibly highly regulated, however, and so if you're trying to reach people who don't have access to it, you got to have other tricks up your sleeve, and that's where buprenorphine is very effective. It's almost as effective. I think the key thing for people to know is actually that not being in treatment is extremely risky. You have 3 to 4 times the risk of death, all-cause mortality, mostly driven by overdose, but all-cause mortality goes up if you're not in treatment for opioid use disorder. And treatment equals a medication, unfortunately. We'd like to say that people could do really, really well without any medication, but that doesn't happen that often.
You can't quit cold turkey.
You can't quit cold turkey.
Much of the attention has been focused on medical doctors prescribing these drugs. But what about other medical professionals like dentists? Are we overlooking those other specialties in the fight against opioids?
At the end of the Obama administration, there was a legislation that passed that allowed nurse practitioners and physician assistants to be able to prescribe buprenorphine and treat it. The other thing is that all medical providers should be able to talk to people in a way that reduces harm from their ongoing use. That's something that we need to do a better job of training people in.
All right, we will have to leave it there. Dr. Scott Steiger with UCSF, also Laura Klivans with KQED, and Brian Washington, Marin County Counsel. Thanks to all of you.
Thank you.
Turning now to foreign policy. On Tuesday, President Trump announced he will withdraw the U.S. from the Iran nuclear deal. Signed in 2015, the deal was one of President Obama's key foreign policy achievements. It required that Iran never build nuclear weapons. In exchange, the U.S. would lift sanctions that had severely stifled Iran's economic growth. To discuss what this means moving forward, I'm joined now by Professor Abbas Milani. He's the director of Iranian Studies at Stanford University and a fellow at the Hoover Institution. Professor Milani, nice to have you here.
Thank you for having me.
So on Thursday, tensions between Iran and Israel escalated as Israeli warplanes attacked dozens of Iranian military targets inside Syria. What role would you say the U.S. pulling out of the Iran nuclear deal played in that?
I think this was part of the same dance, a complicated dance that what I think was coordinated between Israel and the United States. It began with Mr. Netanyahu's conference or show where he talked about all the new intelligence that they had found in Iran, indicating that Iran had lied about its military component of the nuclear program in the past, something that Mr. Trump directly quoted in his decision talk. And I think behind the scenes, I think the United States and the Trump administration has basically given Israel the green light to go at Iran in Syria.
But didn't Iran, fire first? It fired some missiles into Golan Heights. It wasn't like, and that happened before the U.S. announced its decision to withdraw from the nuclear deal.
Right. I mean, Iran certainly has taken aggressive actions in Syria, and it has taken aggressive actions against Israel in Lebanon. Iran has now placed about 200,000 missiles right on the neighborhood, right on the border of Israel, and I think Israel is clearly worried about all of this. The immediate action that seems to have begotten the Israeli attack is the firing of some 20 missiles into the Golan Heights. They hurt nobody, fortunately. They destroyed very little. But Israel decided to respond massively and make a point.
So the big question now is, with the U.S. withdrawing from the Iran nuclear deal, does this raise the likelihood of war?
I think it does. I think it raises the likelihood of a much more serious confrontation between Iran and Israel in Syria. I think it raises the likelihood of more serious confrontation between Iran and Saudi Arabia in Yemen or in other places where they are engaged in a proxy war. What I think mitigates against the possibility of a war is that I think the Iranian regime doesn't really want a war right now. I think they are in a very enfeebled economic condition. I think Israel knows this. I think the Trump administration knows this. I think everybody else in the region knows this. And when you have as much of an enfeebled economy as Iran now has, and you have as much of a disgruntled population as the regime in Iran faces, the idea of picking a major battle with Israel or with the United States is not happy news.
So what do you make then of Iran's position, rather, its assertion that it is ready to restart its nuclear program if this deal falls apart following the U.S. pulling out of the deal? Is that just a scare tactic at this point?
I think it was a scare tactic. It was trying to tell Trump administration not to rock the boat. They said, we will restart our nuclear program full force. We will do things you don't know yet, kind of a sort of King Lear language. But actually, once Trump pulled out, they said, we're going to stay in the deal. We are now going to try to make it work with the Europeans, with Russia, with China, with the UN, with the IAEA. All of these forces and institutions want the deal to continue. And this puts the United States as the odd person out.
Doesn't the Trump administration, though, have a point when it says this deal is flawed? For example, it did not address a number of issues, including Iran's role in Syria.
I think the Trump administration on that point is right. I was one of those people who thought that this deal is the least bad deal, but it was a least bad deal possible. And the least bad deal possible was clearly better than no deal. And the way you fix a bad deal is not walking away from it. You would have a lot more leverage. The United States would have had a lot more leverage if it had stayed in the deal and tried to get the Europeans, tried to get Russia, tried to get China to bring some pressure on Iran to make the concessions that the Trump administration needed. To walk away from it essentially gives the Iranian regime someone to blame for their economic failures. It gives the Iranian radicals an excuse to clamp down on the people, and they've already begun to do that. It weakens the very people who are the only viable force who can make a regime change in Iran. The Iranian people are the only people who can make the change that we all need, a more democratic Iran. The United States can't dictate that. And to weaken those very forces by walking away from it so unilaterally and so unreasonably, to me, was the worst way to fix a flawed deal.
And meanwhile, we have about 30 seconds remaining. I have to ask you this, though. We've got North Korea looming. We've got the talks now. It's been announced that that meeting between the U.S. and North Korea will take place in Singapore next month. What impacts could this withdrawal from the Iran deal have on those talks with North Korea?
One way is for North Korea to think that if the United States can walk away from a deal that everyone else says is working, why would I want to make a deal with them? Why would I want to trust an administration that walks away from such a good deal? The other option is for them to think Trump is not
not trustworthy.
Trust is not very predictable. Sort of the mad leader theory. Play the mad and scare everybody into doing what you want them to do, lest you do something even more unexpected.
All right. We'll have to leave it there. Stanford University Professor Abbas Milani, thank you for joining us.
My pleasure.
Turning now to tech, a group of UC Berkeley students are using their tech skills to fight terrorism. They created Archer, a nonprofit that builds tools to track connections between terror organizations and sanctions violations, among other things. The inspiration behind their nonprofit is personal for these students. In 2016, 2 fellow UC Berkeley classmates died in terrorist attacks, one in France, one in Bangladesh. Today, nearly 24 UC Berkeley students volunteer their time and skills at Archer. They're using data to fight human rights abuses, corruption, and money laundering. And joining me now are the founders of Archer, UC Berkeley junior Anjali Banerjee, Tyler Hines, also a junior, and Alice Ma, who graduated last year from UC Berkeley. Welcome to you all. Alice, let's begin with you. You founded Archer along with Tyler and Anjali. What is it and how does it work?
So Archer builds data analysis software for investigators that focus on issues of corruption, terror finance, war crimes, and human rights. It's like a subset of issues amongst kind of a larger set that we've defined as systemic and critical. So we do this in kind of a dual approach. So the first is through our flagship product, Architect, which Tyler will probably have some thoughts on. And the second is through our partnerships model, where we work with experts that know how to generate insight from data and that are already trying to investigate these issues already.
I think we choose our partnerships really, really carefully. So in particular with C4ADS and the Human Rights Center at Berkeley, because they're the organizations actually holding bad actors accountable for the atrocities that they commit.
But how are you doing that, though? Are you looking at a lot of data and you're then putting it into a format that's easier for organizations to read and analyze?
So we do have partnerships like this, but we do have one sort of major flagship product. We call it Architect. Architect is a big data analysis platform, and it organizes different critical public data sets into an intuitive network analysis view so that investigators can sort of explore connections between individuals and organizations across borders. And these are sort of that's just one big example of the type of tools that we build.
And so, Tyler and Anjali, I know that you were both in Nice, France when the 2016 terrorist attack happened. Tyler, can you describe that experience for us?
I'd rather not talk too much about Nice itself, but in the follow-up, it was really just the first time, at least for me personally, that I was exposed to a problem this real, this impactful, and this serious, and it really just changed the way I looked at the way I spend my time and prioritize what I'm working on. And it convinced me that there are much more important things that I should work for than like building apps or learning about classes and stuff like that. And it convinced me that Archer was something that I should start and take forward.
And Anjali, what was that experience like for you?
I think for me it was slightly different because the student who passed away in Dhaka was one of my best friends. So I was kind of already introduced to what it would be like to experience something like this. But I think for me as well, it just made it really clear that like I could no longer ignore issues of like systemic security risks or human rights violations. And it became urgent that like I also participate in combating that, yeah.
And as you try to build these tools to help, make the links between various terrorist organizations and who are the sanctions violators and how they're related to each other, Alice, what challenges did you encounter?
So I think the challenges that we encounter are twofold. So there's one on the side of there's literally just so much public data that's out there. And this data has been exponentially growing in the last 10 years. I think that's a broader context behind why Archer exists and why it's impactful. Because we've discovered that the newsrooms or the analysts or the nonprofits that are working on these issues no longer able to keep up with the information that's out there. And so that's kind of how we are like making an intervention in the space, I guess, and that's extremely challenging because of just how much data is out there and how messy it can be, and even like the sheer manpower required to kind of gather it all together and integrate it well. I would say that's one major challenge on like a more thematic side for us. And I guess it's something we've overcome thanks to like the ingenuity of the Berkeley students on our team. Besides ourselves, there's 19 other students that dedicate their time to this effort. And that actually brings me into like a second challenge that I think is really important, which is like making an impact in this space when we're students. It's like people always ask us like, oh, you're students, so like, what do you do? Like, does it actually work? And how much time do you spend on it? And I think we've overcome this as well with the help of our team and just being completely dedicated and building a product that speaks for itself.
And you're all volunteering your time, and you've probably in some weeks have devoted more than a full-time schedule to this. And Tyler, when you were developing these tools, what surprised you the most? What did you learn from it?
What really surprised me is that there are all these different atrocities happening in the world, and there's so much information collected about them. However, there's so little work being done just because the tools and the accessibility isn't out there for newsrooms, for journalists, for people who are involved in civil society.
For human rights organizations.
For human rights organizations, there's no real way for people to analyze issues in this way, and we're trying to bring about tools that can change that.
I think what surprised us too is the fact that we were trying to do something that is quite daunting. I mean, the three of us like didn't really care, but getting people, we thought it was going to be hard trying to convince people to like donate their time, essentially, especially a lot of them are engineers and getting like six-figure offers or whatever. But it's actually been really easy. I mean, we have kids who are like taking their finals this week and also on client calls and also spending like 40+ hours. So that was a nice surprise.
And who's using your tools right now? And have you been able to connect with any federal agencies?
So the product that we just launched a month ago is called Sanctions Explorer, and it makes U.S. Treasury data accessible and insightful en masse. So the users of our tools are journalists that work on sanctions violations, people that work at academic centers, like for example at Harvard, that work on non-proliferation issues, analysts that work on illicit finance or like sanctions evasion to North Korea. So these are like a subset of our users. I think we have reached out to the government, like the U.S. Treasury, regarding this particular tool many times. We haven't, been actively engaged there, honestly. We visited them last spring before we started Archer because we demoed several projects that we had built to the Department of the Treasury, and they were very excited about it, but I guess we just kind of fell out of touch.
So does that lack of contact change anything for you? Or are you still hopeful that this is an opportunity to bridge the gap between the Bay Area's tech epicenter, what you're doing, and policymakers in Washington, D.C.?
I think, yeah, it hasn't been discouraging at all. I mean, the day that we launched, I was like sitting in class and our Twitter was just, I guess, blowing up because of all the people who were really excited that this existed for them. So it hasn't been like discouraging or anything at all. Like we really understood in the immediate 24 hours after we launched Sanctions Explorer that like we can have a considerable impact in the space.
And I know that you're all attending the big human rights conference called RightsCon in Toronto next week. But in the meantime, you're also looking ahead, Tyler, as you're volunteering on this. Where would you like to take Archer from here?
So over the next few months, us three are going to be going full time. And that's a big jump for us, going from students working on this with a lot of hours, but we're going with a full commitment, going to this conference, and our big focus right now is to get our products in the hands of as many impactful users as possible, and to really learn about their problems and how we can solve them, and focusing on optimizing for that impact.
And possibly scaling and making some money?
Yeah,
okay.
So a big focus for the next couple months is also Architect, our flagship product, which integrates different critical public data sets and makes them connected and lets people explore those connections.
Okay.
So that's what we're focusing on for the next.
All right, good luck to all of you. Alice Ma, Tyler Hines, and Anjali Banerjee with Archer. Thank you.
Thank you.
Thank you.
And that will do it for us. As always, you can find more of our coverage at kqed.org/newsroom. I'm Thuy Vu. Thanks so much for joining us.